now you're going to move back home after 11 years.
Yeah.
You finally make it back to Sweden.
Yeah.
And you ended up as CEO for Sherwin and Plough. That's like for Claritin and Nasonex.
Yeah.
Allergy medicine, antihistamines.
Yeah.
So that's on the rise, allergies.
Yeah, exactly. So I think that was a fantastic opportunity for me to be a CEO for that company, because it was on a growth trajectory to be a really big company in the Nordic countries. And Claritin and Nasonex. Claritin for allergy, and Nasonex for hay fever and nasal congestion. So that was a fantastic time. And after some years, I became global chairman of the brand team in US, and was running the whole world for these two products. And I think from a commercial perspective, it had been my biggest job ever. It was $4 billion in turnover on these two compounds, and it was a growth rate of 10%. And it was big decisions to make to have an off-patent strategy, because when a product go off-patent, everyone can produce it. But as always, we were trying to build a strong brand with a OTC, over the counter, that you can buy like in ICA or in
Claritin is everywhere.
Exactly.
Yeah.
So, but Sweden was first out to have it OTC in the world, and after that came Canada, and we were launching in China also. So it was really big markets, and it was very much to calculate sales for sizes, to have the right power behind the products everywhere, to save the sales, at the same time grow the brand. But it's a big transition to have a prescription or X-drug, to have a OTC when it's the brand name is carrying the value of the product.
For me, you can't go wrong with Claritin, because the pollen count is so high now, with the world getting a bit warmer.
Yeah.
They say the season is in the last few years, it's 3 weeks longer.
Yeah.
I'm taking more allergy tablets this year than I did last year.
Yeah.
I'm supposed to take 2 a day, but I just take as I need them. So, would you like to Yeah, but it seems like a very good business to get involved in.
Yeah,
because you can't avoid it. If you have allergy,
no,
a lot of people are allergic.
Yeah,
so you can't avoid taking it.
But you have allergic against me, or
but it's your cheap aftershave, Mark. Yeah. I asked you many times to stop wearing it. Or is it the flowers on your shirt? I don't know.
Both.
I know.
Yeah.
But you were doing a lot of traveling with this, because I have it here that you became a SAS lifetime gold member. The amount of traveling you were doing back and forth to New York.
Exactly, that's have been really helpful since I stopped my career to travel to US and other places. So it's always nice to have that lifetime gold card. Now SAS have changed groups. So they used to be with Lufthansa in Star Alliance. And now it's with KLM and Air France.
Sorry, what is that? SOS? What is it?
SAS.
SAS. Aha! All right. I thought SOS gold.
Yeah, lifetime gold member.
Okay. Yeah.
It's not the 112.
Oh, okay.
But you've definitely done the yards with that company. Yeah. You were flying back and forth for so long.
Yeah.
Yeah. Getting into this is interesting.
Mm-hmm.
The CEO at Organon Bioscience for women.
Yeah.
This is a different thing again now. Yeah. I know, yeah. Your life is a book anyway. We haven't even gotten to the end, but Mr. Widen, you must pen a book.
Yeah.
bioscience for women, fertility products, and IVF contraceptives. So it's both. It's
both ends.
It's trying to pro-life, trying to create life, and then the
trying
other one
to end it.
It's not but prevent it.
Prevent it. Yeah.
So it's a mixture, really. This company.
We can call it birth control.
Birth control. Yeah, that sounds really good.
That's a very diplomatic way of saying it.
Yeah.
Birth control.
Yeah.
It's controlling the birth.
Yeah.
I tried to make it a bit controversial with the pro and anti.
Yeah.
So, what was that like?
No, I have worked in therapeutic areas like cardiovascular, where we have myocardial infarction, stroke, lipid lowering, gastrointestinal with ulcer, allergy, oncology. But women health, that was really a new area, and was a new target group to work with education material in school and so on for the contraceptives. So we have a variety of different things that to fit everyone perfectly. And the other one was the fertility product, what have come into the limelight even more now recently, when we're talking about how many attempts should be subsidized by the government, and it's quite expensive, and people are going outside the country to get pregnant, to Denmark, for example, and various different rules and regulations everywhere how treat that dilemma, if the father should be known and or not, how this so it's contraceptive is much easier to deal with. But one of my, I think, big achievements in women health was I was attending the political week, Almedalen, a couple of years in Visby, and we were pushing very much to give support for young girls to get free contraceptives from, let's say, 15 years up to 24 years. They don't pay anything today. It took 2-3 years after the government decided, okay, this is a good thing, because unexpected pregnancy and abortion for a 17-18-year-old girl can sometimes create some psychological issue also, on top of the burden to take decision to do it or not to do it.
Yeah.
So I think it's an investment from the government of 200 million SEK per year to give free contraceptives up to 24 years old. So I think it's a cheap solution, because if a 15-year-old girl have to pay the amount for the contraceptives, and the boys is just buying a can of a 6-pack of beers for the same amount, it will not be equal, really. So
No.
They kind of connected as well. A man a boy having beers.
Yeah.
That's when you make your biggest mistakes.
Yeah.
She looked good in the nightclub.
Yeah, exactly.
Speak for yourself.
Yeah, exactly.
9 months later, little Timmy comes out.
Yeah.
And the can is still empty.
But was this Organon Bioscience company, was this in Sweden or America?
No, it came from Mark's homeland.
It's come from Holland.
It's from Holland, yeah.
All right.
Yeah.
Jeez.
We're really Frankenstein people there.
Yeah.
You're kind of open and closed over there. I don't know what's going on.
So Organon was a world leader in women health. So
Okay.
Yeah. So
Maybe because of all the hookers in Amsterdam. I don't know.
You need that's right.
exactly.
Yeah, okay.
Yeah.
Didn't know it.
Mm-hmm.
I know. But were the different departments, were they side by side? Was it like, this is, if you go left it's fertility, if you go right it's contraceptive? Was it the same in the same building?
It's gynecology,
Okay.
both of them. So the gynecologists are the main target group to discuss with, to develop new contraceptives. And with the fertility, is also gynecologists who are very much involved. So IVF is not a nice thing to do. It's little romance in that type of
What's the IVF?
in vitro.
Okay.
In vitro, yeah.
IVF,
So you are fertilizing the egg outside the body, and after that you put it inside.
Right.
Okay.
Hmm.
Oh, so it's a woman is getting implanted with the fertile
Yeah.
eggs.
And it could be from
another animal.
from her.
Exactly. It's coming out.
I just got a picture in my mind. There's a bull out there.
We use ducks and we use mouses. Everything.
Yeah. I know, because years ago, like condom in Ireland was a dirty word years ago. I can remember my father saying, "Don't keep them dirty things away from me." But he had 6 children, so maybe he should have used it
A few times.
But in the past, people get pregnant very early, like 20, 22, 25. Now they are waiting for education and all these things. So
After 30.
for every year, so I think in Stockholm, I think the average age to get the first child is about 35.
35.
Yeah, and in the whole country is like 28.
That's
so,
late.
So people don't like to put children on the ground without knowing that they have something good to offer them.
It's
And
good in one way, but
Mm.
I think they're closing the school in Vestervik. Because of lack of children.
Exactly.
But on the other end, people getting older also. So it looks like that's not the only thing that is shifting, but also other stuff.
But to keep a population on the same number, you need 2.2 child per woman. Now we are down on 1.4.
All right.
So that means
We have to think like Chinese people.
Yeah, but I think the cost of living as well is coming to play. Yeah, if you're a young man now and you want to start a family, you can't have like 3 or 4 kids now.
No.
Yeah.
You can, like, but God help you.
Yeah.
So maybe it's doing it a little bit smarter.
But can we help in this, Kevin and I?
I'm helping all the time.
Yeah.
I'm helping all the time.
You guys can start in breeding.
Team effort.
Team effort. All for the country.
Yeah.
If it comes out blonde, it's Mark. If it comes out with brown hair, it's Kevin.
Yeah.
I know,
but you're still working in that now. You're still CEO, or
Yes, but in other therapeutic areas. So we are.
we get there.
We've only scratched the surface.
Yeah,
Sorry,
exactly.
guys.
Yeah.
Sorry, guys.
Yeah, this is only a scratch. We've a long way to go. Yeah.
Okay, forget it. We get there.
I know, but it's so interesting that I find that the fertility and the contraceptives together. It makes sense though.
Yeah.
And I like the way you said it, birth control.
Yeah.
It's controlling if there's going to be births or not.
Yeah, exactly.
So, and there's all different types of contraceptives that some women, they take the pill.
Yeah.
And then after a few years, as they get older, I've noticed it agrees with them less.
Yeah.
And then you have the coil.
Exactly, the rods.
Yeah. Yeah. And then for the men, you have the snip.
Yeah, exactly.
Yeah.
That's more dramatic.
Yeah, I've been there.
Yeah.
I done it live. In October 2001, I drove down to Nequa.
Okay.
And I got my vasectomy done.
All right.
And I was awake when he done it.
Oh.
And the doctor was brilliant anyway. He told me a brilliant story about him cycling a bike through the Tour de France.
So you can't join the Mark's breeding team here?
No, but I didn't want to tell him that. He'd only stop doing it.
Yeah.
But it basically 2 puffs of smoke, 15 minutes later it was over.
Yeah.
But there was a walk of shame there.
Yeah.
As I was in the sitting area afterwards, you have to sit for half an hour before you leave.
Yeah.
There wasn't so much eye contact between me and the other guys.
No.
But the doctor I had anyway, he said he's done over 5,000 vasectomies.
Okay.
Which is a lot.
Yeah.
So that's happening more and more now.
Yeah.
So, but for me, it was I was 45 or something at the time, or 40, whatever.
Yeah.
For me, I have 3 children. That's enough.
Yeah.
So for me, it was sensible to do it.
Yeah.
So, but that's another option. That's another birth control.
Yeah, it is absolutely, and
Yeah.
it has been a lot of research to develop products for men during decades, but they haven't not really find something what is effective enough, except the way you have taken.
There's another option you can do it if you do it in Oscarsham. They put you to sleep.
Mm.
I went the brave man's route.
Yeah,
I done it live.
You're an Iron Man.
An Iron Man. I have a photograph of where he done it at the bench.
And you
Okay.
did it with a kitchen.
I don't know if he mightn't even done it. I don't even know.
Have you framed it and put it in the bedroom?
I'm going to give it to the grandchildren.
Yeah, exactly.
I don't know. But then you've done a few years there, and the Sheridan Plough acquired by Merck.
Yeah.
They're like the 3rd biggest pharmaceutical company in the world.
Yeah, exactly. So it was two almost even in size. It was a merger of equals, but Merck was in the driving seat, and all CEOs were released from Sheridan Plough after the integration was made. So first I felt that was not really a good thing, because they said from the beginning it should be the best talent in every country, and Merck was like number 11 in Sweden, and Sheridan Plough was number 2 or something like that. So I thought, and the portfolio that we have was growing and the other was declining. But in the end I was so happy that, because if 2 pharmaceutical companies from US going together in a merger, it will be so nice packages for the ones who have to leave. So, and I felt high confidence that they will be attracted by other companies later on. So, but it was like a financial independent situation for the rest of the life when I was 52, 53 years old. So it was very, very nice to have that as a backpack or a parachute or
safety net.
Exactly. But it became so boring. I was traveling the world for 1 year and tried to see a lot of places and so on. But when people are calling and say, "Can you do that? Can you do that? Can you be here?" and so on, I decided to go back to a position. So it was lovely.
Oh, so you got the nice lump sum, so you could have just kept traveling and.
Yeah.
But after a year, you noticed then.
Yeah, the 2 years maybe it was when I started with some consultancy work for a UK company. To calculate sales forces and marketing power for launching of new product. That was quite nice. I could do it on hourly basis, but after some time I came back and as a CEO for a medtech company who produced machines for devices. So we for example, the very well-known Ozempic today from Novo Nordisk, that is a weight loss and diabetes product. We made the machines to put all the parts together. So as a syringe with a counter and active substance inside, and so it was like 10 stations that we put them together. It was 3 vision cameras, and after that, if the product was put together in the right, it went to the next station. So it was like 120 syringes of Ozempic per minute produced in this machine. Okay. So it was high speed and enormous precision, and if all the quantity of pharmaceutical in the syringe go into a body, the patient will die. So it's very we have to be very precise in the production and to have the FDA approval for everything. But it was really nice to set up this, and it was not only Novo Nordisk, it was other. We also produced for my former company AstraZeneca the turbohaler that you take for asthma and allergy. It's a dry powder inhaler. So that one we also made machines for. So and when the machine was ready, we split them in parts, put them in a container, and send them to Singapore or to USA or something like that. And after that, the same team who had built the machine went over and make a validation. And after that, we put GSM cards inside, so we could follow the machines remotely from other side of the globe to see that everything works perfectly. Because sometimes it's very difficult to connect the machine to the local company's intranet or Wi-Fi net. So we have to work separately to monitor the machines. And
would India and China, these highly populated, high pollution countries, they would be more asthmatic, I imagine?
That's not true, really.
Okay.
I learned that when I was in Poland, because they have these brown coal mines everywhere, and they open pits that they are digging brown coal. So the area in the south, where Katowice, Wrocław, and in that triangle there, it's called the Triangle of Death. They are breathing so much brown coal and things from the air, but they don't have more asthma than we have in Sweden. So it's, I think, more not only coal and these things. There is a saying in Poland for fun that you should see what you breathe.
Okay, you can see the smog in the air.
Yeah, exactly.
You know what it is.
But then you trust everything.
Yeah. Because my sister Michelle was very asthmatic when she was younger.
Yeah.
And it was the big thing.
Yeah.
Where's my inhaler? And if she didn't get it, she couldn't breathe. My little Nasty as well. When she was younger, she had. Is it called croup? Is it?
Cough, little cough.
Yeah. So with the fresh air, take her out to the balcony and give her some fresh air.
But I think heavy traffic in the big cities is absolutely not good for your body. So
maybe it's not asthmatic, but maybe it's just poison.
Yeah,
it's just poison.
I had children asthma.
Yeah.
When I was young, like 8 years old, 9 years old.
Mm-hmm.
Yeah.
But when I start cycling to school, so I cycled every day 30 kilometers.
Yeah.
Then it went away very fast.
So it's kind of a youth. Is it kind of a having asthma? You can kind of grow out of it. Your lungs get stronger as you get older. Or is it something like that?
Yeah, and also allergy can disappear. Also, the body can adapt to a situation, and you can get rid of it. So, but it's not
also the other way around, maybe.
Yeah. I got some allergy when I was 30. But it went away when I was 40.
All right.
One of my oldest son, he got also allergy when he was 25, and I think it's much better now. And
what was it? Your allergy?
It was like hay fever, birch trees.
All right.
Yeah.
I was going to say condoms.
Yeah,
it was true.
Condom and women.
Yeah.
The damage was done by them.
The banana taste.
Yeah. All right.
Sorry, I had to.
But that's interesting, actually. That it comes and then after 10 years it goes away.
Yeah.
Without doing anything.
There is one treatment called sensibilization, that you give the things what you have allergy against, and after that you take a number of shots, and after a while the body acclimatizes for the new. So that means if you give small doses. Yeah.
All right.
A doctor, or was it a nurse years ago, told me that if you're allergic to something when you're younger, as a teenager, she says when you're an old man, some of them are going to come back again.
Mm-hmm. Okay.
So
Okay.
yeah.
Good.
We're full of good news. So don't forget your inhaler.
Your childhood asthma will.
Does it look bright for the future for me?
Yeah, where did I leave the inhaler? I know, but not going back to the allergy stuff. But the allergy, it's interesting how the body reacts. And
Yeah.
if there was pollen in the air, your body releases histamines trying to fight it. The body doesn't know that it's just pollen in the air. So our bodies react to what we give them, really.
Yeah.
So allergies as well. I had a glass of wine last night. Finally.
Yeah.
And I got a rash when I finished all this completely.
Yeah.
He's an
You
alcoholic.
deserve it.
I give myself a pat in the back.
He's an alcoholic.
Which we're going to talk about that later as well.
Yeah.
But straight away I get like a red rash here,
Okay.
and it's an allergy to alcohol.
Yeah.
Right.
It doesn't stop me. It doesn't stop me though.
Okay.
But that's an obvious one that there's an allergy to. So, well, I think we're more allergic than what we think. I think we've a lot going on.
Yeah, maybe.
Yeah. But we done the merger, and then we ended up. Now is this the same company? You're the CEO of First Lab.
First.
Yeah.
First. F with the German U with 2 dots over.
Okay.
Yeah.
Okay. I missed the dots. Oh yeah.
First.
First Labin.
Yeah.
But that was clinical tests, one of the largest in Europe, and it's mostly on mice. Is that it's mostly animal testing?
No, it's the largest lab, standalone lab in Europe for diagnostic, like outpatient clinic.
Yeah.
Sending tests to one place. So we took mostly over the Norwegian market and a lot of the Swedish market as well. So we're sending these blood tubes, like 30,000 every day into the lab. So, and after that, we built up a long automation line that collected these tubes. So they went, so if the doctor was put into the computer, I like to have 4 tests done on this patient. It went around, and after that it was sending back the result to the doctor's computer. But after they put it in a fridge, so the sample could stay there for 10 days. And if the doctor said that, no, I'm not enough with these 4, I can order 2 more. And after that, a robot put the tubes up on the line, and after that it take a second turn, and new data came into the computer. So instead that patient had to come back, take a new blood sample, and take time out of work and so on. We could utilize the blood until it was expired.
Oh, because it's the blood. There's a thing called the blood bank, where the blood is stored.
Yeah, but this was just sample. It was not for the blood bank. It was more to save the glass tubes until it was not any possibility to take some test. And after that, it was the robot was taking and put into the waste container in the basement, and after that, taken away.
So does like medicine? If you buy medicine, you have it at home. It does go off. If you check the back of a medicine box, it goes off in time. Yeah. So it's a bit like blood. Does something happen to it?
Blood, it's changed its characteristic after 10 days.
That's fast.
Some tests you have to do immediately, and some you can do a little bit later. But a lab like that can make like 100 tests at least in different automation machines. But the good thing what we developed here was to utilize the blood as long as possible, instead of asking the doctor to take the patient back for new tests, because that's creating a lot of costs for the patient, for the society, and for everything. So with this number of fridges was really good.
Yeah. But then we're getting closer now. I don't know where I wrote down mice twice. I got some session last night.
Twice.
Was there somewhere where is there some place where you were working? It was like we were talking about the last day where they had to do loads of testing on mice.
Yeah, we do that now. In the company I work for in London, we are making a lot of tests on mice. What I have worked for in Sweden on the development side is more on tissue diagnostic, but that's biopsies from man, from breast, prostate and other places that you take out the tissue and after that test it.
Oh, it's a real sample from a human.
From a human, yeah.
Before we go there though, let's give a shout out to your, because around this time you were working for the first lab. It's rolling into where you met your lovely Marie Schwartz.
Yeah, exactly.
Yeah. Life partner.
Yeah, exactly.
Yeah. I can see.
Is she German?
No, she had Dutch origin from a number of generation back.
Right.
So Schwartz can be spelled in different way, but she spelled with T Z in the end. But in German they have no T before. It's Schwarz with like.
Schwarz.
Schwarzenegger.
Schwarz.
Yeah.
Okay.
Yeah.
But Marie was a top athlete back in the day. She won 3 medals, or she was in 3 Swedish championships, and she won 3 Swedish championships, and she also won a bronze medal in the World Championships in aerobics.
Yeah.
Yeah.
We have very much the same mentality. She have practiced much more than I have done ever. So to be good in aerobic or gymnastic or something like that, you have to practice like 30 hours per week.
Wow.
With everything, every detail, because it's judge is what is looking exactly how you hold your hands and how you move and so on. So
a lot of details.
And she also worked as a product manager for AstraZeneca for asthma and allergy.
Oh, she was there as well?
Yeah. She was in Sweden and I was working abroad. We never met each other, but we came from the same town. And
you're probably on the same plane and you didn't even know it.
Exactly. We found each other, and I think we are supporting each other very much today. She's heading 2 pharmacy shops in Västervik, and she's working with all pharmaceuticals, and I could help her a little bit with leadership and knowledge among some product area. And she is supporting me very much because she knows how important it is with new pharmaceuticals, with new treatment and so on. And what we come to later maybe is Alzheimer disease.
We'll get there, yeah.
Yeah, we are going there later. And that is something what we have had in our family also quite recently. So we have double interest in that area. And even if I'm 70 years old next time, she supports me very much to travel around the world and doing things.
You give each other a nice lift.
Exactly, yeah.
Yeah, but for me, it's nice to me. I feel I could see there's so much love there between you, and it's nice to have a life partner.
Yeah.
I like to call it the life partner.
Yeah, it is.
Because you met your match.
Yeah, exactly.
I feel that.
Yeah.
Nah. The only thing, and I love that portrait. There's a massive portrait in your kitchen by Benny Ekman.
Yeah.
It's got all your loved ones, the children, the grandchildren. One grandchild is missing.
And both. It was made before the first grandchild was born.
Okay.
And it was the picture was made before all other houses in the area were. So our house was the only one on the seaside. So it was.
But me and Henry were talking about it as maybe you can build a scaffold and Benny Ekman could come in and draw in. We can record it. We can show it. Really cool.
Yeah.
In Benny's style, lots of birds and the crooked.
Yeah.
All right.
Yeah. Now, your patent This is really important stuff here now.
Yeah.
I want to say it right. The nanoparticles in the tissue diagnostics in digital pathology.
Yeah.
In other words, it detects cancer cells with higher precision.
Exactly. Yeah, so the story is that I was recruited in a board of a company, of a startup in Lund, South Sweden, who have developed a technology about the patent in nanotechnology. We have an invention that was patented to use for animal testing, to put nanoparticles on pharmaceutical substances and to put these substances into the sample animal, and after that, without killing and slicing the animal, we could use laser technology with wavelength on the nanoparticles, so we could detect if the substance was in the liver, in the kidney, in the heart, or whatever. So we could follow different pharmaceuticals. But animal testing at that time became an issue in many countries to do animal testing, even if our method was much, much better to reuse the animal several times. And it could be very good also because the variability between different animals will go away if you use the same animal but different substances. So it have a lot of advantages. But my idea was instead of using living animals, to use biopsies from patients, to take a biopsy of a breast cancer area or a biopsy of a prostate cancer area, to take an example. Take it out, put it on a slide and scan it. And after that we developed a scanner, and my patent is to use nanoparticles for tissue diagnostic, and that patent is validated in US and Europe and Asia now. The advantage with this technology is that if we take, for example, breast cancer, there's three different levels: stage 1, stage 2, and stage 3. In stage 1, you wait and see, take new samples after 1 year or something like that, and doing more or less nothing. Stage 3, it's the full package. It's surgery, radiation, and oncology treatment, and or immunology treatment. So depending on different cancer. But stage 2, there is no stage 2. But stage 2 means it's either stage 3 or stage 1. Mm-hmm. But it's very difficult for physicians to decide if it should be 3 or 1. Mm-hmm. So there is a over-diagnostic today from the stage 2 up to stage 3, because physicians don't like to make any mistakes. So that means that a lot of women get through this package of what is going on in stage 3 with all things of surgery and rehabilitation and so on, a little bit too many. Mm-hmm. But with this method, we could probably detect exactly if it should be 1 or 3, because it's more precise. Because if we take 3 pathologies is looking on the same sample in stage 2, 2 of the pathologists will have one opinion, and one will have another opinion. And to have 66% knowledge in one direction and 33 in another is not good enough when it's such a serious disease. Mm. And just recently I read that the IT company Oracle Biosciences, one of the biggest one, have now joined this development of this patent and diagnostics. So I think it will be very interesting in the future to see. So I'm really proud of what I've contributed with.
It's gigantic. It's the old cliche though about cancer is if you catch it early.
Yeah.
If you can just catch it early and cut it out.
Yeah.
So.
Yeah, oncology treatment as a group have improved so much almost everywhere. It's just some few areas now where what is very difficult to solve. But the most common one, prostate cancer and breast cancer, is having a completely different outcome from what is going on earlier, like 20, 30 years ago.
Yeah, I have my niece Michelle, she's stage 4 liver cancer.
Okay.
And that was detected early, but when it was at, I think, 2 centimeters, but nothing was done.
Yeah.
And then when she came back 2 years later, it was 10 centimeters. 2 weeks later, it was 13.
Mm-hmm.
So there's a bit of there between the stages. I think something could have been caught a bit earlier.
Yeah, so liver, pancreas are areas, bladder are very difficult, and these organs are very deep also, very difficult to reach. And on a slide with a biopsy, they look very much the same, the coloring and so on, the healthy tissue and the sick tissue can sometimes be difficult to see where is the line.
But the radiation part of it then, okay, she had a successful operation.
Yeah.
And then she went for her chemo.
Yeah.
And as you say, because it's so deep, it's a deeper organ.
Yeah.
That they said that to give her, like, I don't know how many bouts of radiation. That's stopped now.
Mm.
And they say to her, there's a good chance it's going to come back.
Yeah.
So is there anything magical in the next few years that can happen when it comes to something like this?
I think the most revolutionary what have happened in the 10 last year is the immunology treatment for oncology. That's this chemotherapy, as you mentioned. It's killing cells, and they are killing also healthy cells.
Exactly, that's the problem.
Immunology is driving your body to take care of the cancer itself very much. It's triggering the body with immunology cells. So I think that's a much more easy way. That means you don't kill so much to get rid of something.
You're just killing the cancer. You're not killing all the good stuff.
Exactly.
That's right beside it. Yeah.
Because we get cancer every day, all of us. We have millions, billions of cells in the body who are replacing each other every day like that. And it's often go wrong, but the body take care of it.
Fix it.
They're fixing it itself. But when your immune system is not strong enough and can take care of it, that's the time it's going over to be a healthy cell to a cancer cell.
Yeah, that makes sense, really. Yeah. So your immune system is more important than what we think.
Exactly.
Yeah. Yeah. I started drinking collagen for breakfast. It's just like it's good for your immune system. That's what it says on the package.
Yeah.
So I have that for breakfast.
Yeah.
But you also take a whiskey for breakfast.
Oh yeah. Well, that's what. As soon as I pull into the job, they stop fertilizing.
Yeah.
You know, so I can do that now.
To be able to handle the customers.
I hope they don't smell it off my breath. I know, but so hopefully, cancer is such a dirty word. It's just a dark word.
Oncology is maybe a little bit softer.
Yeah, but it's so nice to hear. But I think it's going back to your patent. If it's detected early, high precision, that's going to help a lot.
Yeah, but there's a lot of things is going on, and the research going on in oncology is amazing, and we can also see the result out of it. So I think in breast cancer is 95% survival today. So and it was very low when we start to detect this terrible disease.
Yeah. So the future's looking bright.
And early diagnostics, as we said earlier.
Yeah.
All right. Now we're going into when you became the CEO of Indivior.
Yeah.
A project for long-lasting project for drug addiction.
Exactly.
All right.
Yeah, here we go, Mark.
Oh yeah.
Finally, your favorite area.
Mark's from 30 kilometers outside of Amsterdam. That's all I'm saying.
Yeah.
But the drug Subutex, also known as boob.
Buprenorphine.
Boob. Yeah, thanks.
Yeah.
Taken in tablet form.
But the good thing that you can't pronounce it, it means it have not been on your shelf at home.
Oh, I know, but I'm playing poker here as well. If you open up this drawer, you'll find
Exactly.
I know this is because I'm from Ireland and there's so much addiction in Ireland. Alcohol, gambling, everything. Ireland has a good mixture of addictions.
But okay, talk about this therapeutic area a little bit. So the biggest market for drug addiction is US, for sure. And what is going on with the import of illegal drugs from Latin America is fertilized with such problem. So I think what the government in US is trying to avoid is not only foreigners, it's more the drugs what is destroying the mentality of the population, because US is the first place on earth now who have a negative trend in life expectancy. Wow. So and a lot of people are saying that it depends on the usage of drugs, because not only the use itself, but also that the mentality you create of eating healthy food, doing your exercise, the meaning of life, everything goes down when you start to use drugs. We can use the word heroin here. Of course, there is a lot of other stuff in the same area. So this is not mainly for alcohol or smoking, and so it's heavy use of narcotics. And if we take Sweden as a country, we have a very tough way to look at it. It have been in the past very high doorsteps to come into treatment if you're a heroin addicted person. So you have to be almost healthy and clean to be able to get treatment. And treatment is also narcotics. It is controlled, it's made in a factory, it's a dose what is perfect for that patient, because if you
no, I saw a documentary about it. They use it in Holland now for many years or decades for heroin addicts. So they go there to a building or whatever, and they get their drug, but it's no heroin, but it's
opioid.
It's opioid.
Yeah,
exactly.
Yeah, and so they get a dose, and then they go. They keep better control of them, because otherwise they're laying in the streets and going to rob and stuff, and
because when you use heroin, you're destroying receptors in your brain that is giving signals to your body to feel good. If you destroy these receptors, you don't get any response. It's like kids today who are playing with the phone. They get a lot of adrenaline and other things coming, and this is also coming from the heroin. But the heroin is also destroying the normal production. So when you should stop using heroin, you have to replace that in a lower dose of opioid and under control conditions. So as you mentioned in your home country, various centers. With centers in Sweden and almost everywhere also. But the view of if a heroinist is a patient or if it's a disease that he have acquired himself, should they be treated like diabetes or another disease? And that's my point, that if you look at this like a disease and you like to have the patient back on track, it's the most cost-effective way is to give him treatment, because heroinist is, in Swedish currency, they are consuming like 25,000 SEK per day for the society. They are stealing cars, they are selling, they are going to the hospital. So they are creating a mess around themselves. And to give them treatment for some few kroner per day, it's really worth the investment. Yeah. But some people think you shouldn't replace one substance with another substance.
A new addiction.
A new addiction, exactly. Yeah. But it's definitely a way out from it. Yeah. But our heroin centers in Sweden have been playing a very tough game with the patient to come into this program. They really have to be like a Sunday church boy before they come in. And what happens often with that is that they are dropping out, and during the weekend they drink some beer and do something like that, and they don't go from one position to a perfect position. And sometimes in this center they have kicked them out on the street immediately if they have misbehaved. But you can compare it if a diabetic patient go to the candy store, Hemmakväll, on the Friday and buy a big 1 kilo of sweets. And after that they are destroying their diabetes. And after that on Monday we take away all the diabetes treatment for them.
Go back again next Friday.
Exactly. Yeah. No, but it's the view of the disease what is very much showing the result in the country, how they can. Finland have a lot of heroin problems, but they also have one of the best treatments in the world. France is also really good to treat drug addiction.
Will this medicine work for like alcohol, and alcohol is a different one than heroin?
Yeah.
I think, can I throw in like gambling is an addiction as well?
No,
that's more mental.
That's no. This is because if you use heroin as we said before, you're destroying receptors, and you don't get the dopamine effect and so on. So that's the reason this type of treatment is necessary to come back. In 1-2 years, they can be absolutely perfect.
Because I bring gambling into it, because gambling is a dopamine thing.
Yeah.
Your horse wins. You get a bit of money and you get the little dopamine thrill. Yeah. So you chase it again.
Yeah.
So that's a mental one. But I think alcohol is, I don't know, I'm going to ask you now, is alcohol more mental and physical addiction?
I think from the beginning it is a mental addiction, and I read recently that our genes are changing during hundreds or thousands of years, so we will have less and less alcohol problems in the future.
So you think it can be passed down like hereditary through like your genes?
Yeah, but I think the dopamine effect from what you get from your mobile phone 24 hours per day, it's can sometimes be worse when to drink some beers.
Yeah, I don't know, the beers do a lot more damage.
Yeah, but it's good news for you. Yeah. If you're going to live a few thousand years.
Yeah, this is I'm making out that this is for the audience, but I'm talking about myself. Like, and if there was a, I don't know, but this is I loved it because it's everywhere. Yeah. Addictions is everywhere. Yeah. Every country, every household. like everything.
But I think all addiction have to be treated like if it is gaming, if it's playing on the mobile phone, it could be a different type of gaming, or to wait for a response from your social media thing, or
Count how many number,
or if it alcohol, or if it drugs, what we talk about, like smoking also.
But they're socially accepted. Alcohol and cigarettes.
Yeah.
They're socially accepted.
But addictive people, do they have a higher addictive gen in their body, or?
I think it's differ a lot between people, and some can stand more against it, and some are falling into that road very easily.
Because I read about something that it's more in some people, that's more in their genes.
Yeah.
So they have a harder time to do something against it. It's just in their genes, so they're
And I think
it works like a magnet.
Yeah.
Or
like your environment as well when you're growing up.
yeah, probably.
If
Oh
you grow
yeah,
up
it can
and
be
there's
a
no
mix.
alcohol
A mix
in the house.
Yeah.
Yeah. Yeah.
But I think I grew up and there wasn't really much alcohol in my house. But there was, back in the day, there was pubs everywhere in Ireland.
Yeah.
So that's an environment thing. But that's changed now. Ireland's a lot more healthier now.
Yeah.
Easy access. As you
Easy access.
Yeah.
That's the thing. So I think environment and genes mixed together,
Yeah.
and personality type.
Yeah.
Yeah.
Because I'm addicted to my phone, and
In a way, yeah, more or
we all
less.
have our addictions, really, don't we?
Yeah. But in certain levels, maybe.
Yeah.
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 What's your addiction?
I think I have been very much to the mobile phones also in the beginning, when start with social media, and when I work as CEO, we use with this sharing plow, what you mentioned, we start internal blogs in the company very early, before blogs and influencer and everything. So I have always been interested to develop things in that direction, but I have, of course, as many others, not understood when I start to be addicted, and to wake up in the middle of the night, sometimes, okay, I was watching on the phone, okay. And especially when I have worked on a global basis, you have people with 9 hours in one direction in Vancouver and Seattle, and you have 9 hours in the other direction, and it's things going on all the time. You get up to speed, and I think that's really unhealthy.
So did it disturb something in your life?
Absolutely. So,
Right.
I think to work on global basis is not good for your sleep pattern. I think that's
Yeah.
something I try to avoid now,
Yeah.
if it's possible.
Shall we not talk about my addictions? Then we're going way too off track.
We need another hour, Mark.
We have another hour. Okay.
What's your addictions?
No, I don't know.
I think
It's a new episode.
Yeah.
It's a new episode.
Mark's addictions.
Something with women.
we can put a little inhaler in there.
Something with women and tube, but something otherwise in between. No, I don't know.
But I, in the future anyway, I hope that we can have some drug addicts come on.
Yeah.
That are in recovery,
Yeah.
or more so they're recovered.
Yeah.
They can talk about their journey to recovery, and
Exactly. I think that could be really interesting to take them in here. Someone who have went the full.
they've lived it. But I'm thinking more so than you live close enough to the prison. I have an idea that we can get
We can take something out. Do we have a key?
druggy prisoners that are close to release, that have cleaned up their act, let's say, and let them come out here, and they can sit here, and we can talk about how do they end up where they ended up, and what do they want in the future, and it could be a good conversation.
Oh yeah,
because we're all interested. It's an interesting topic.
Subject. Yeah.
We have always when we have sales conferences in the companies I worked for, we have always invited patients for the treatment what we are offering. And as we were talking about IVF before, it was very interesting to listen on couples who went through this, how tough it is with all the different hormone depression, hormone increasing, to put the fertilized egg outside to see if it works, and so on. And the same with the drug addiction patients. They are also very interesting to listen at, because many of them are like us here from the very beginning, before the journey is going down.
Something happens.
And when they go up, they have so much to tell us, how it was down there, and how I came back. But unfortunately, it's so much overdose death in this area. So for that reason, this type of treatment under medical control is saving so much lives.
Yeah, it's some people hit the rock bottom and they don't get out.
Yeah, because what you buy on the street, you cannot control what is inside. It can be too high, it can be low, or it can be different from the last time. So
yeah, but the Subutex, it's like a micro dose of an opioid.
Exactly.
And that's just going to keep them stable, so they don't have to get dope sick.
Yeah. So we developed an injectable Subutex, so that you take one shot per month and put the plasma level of opioid in the bottom. That make it much easier, instead of taking a tablet every day with your plasma going
Sounds
up and
nice.
down.
Yeah, I think I need it now.
The first of every month.
That you brought something with you.
Is this the way he done it there? I really liked it. Yeah, I think you can just be like steady for the whole month.
Yeah, maybe.
I mean,
maybe you like to have before you have develop your addiction.
Yeah, exactly. Oh yeah.
We don't know what it is, but just give it a shot.
Yeah.
Okay. Now we're up to 2000. We're getting closer now.
Yeah.
Once again, the senior chairman of the board at the Rennie Pharma Group.
Yeah.
And then you moved into the senior president for the Nura Code FDA approved biomaker.
Yeah.
For detecting early signs of Alzheimer's disease.
Yeah.
This is massive as well.
That have been one of the most exciting work I have done. So it was during 2024, it was developed the first FDA approved diagnostic in the world for Alzheimer's disease. To take a blood test and see with high precision if the patient have Alzheimer, yes or no. It was developed 2 pharmaceuticals at the same time from 2 companies who were launching on global basis. And the pharmaceutical couldn't be used if we don't know if the patient have Alzheimer or not. If they start to treat, they like to follow the efficacy of the treatment. So the precision diagnostic was really key. And it was a group of 3 professors who called me and asked if I could help them to launch this new knowledge and awareness that now it was available around the world. And they know me well, and we have worked together, so they know I could start, let's say, like the week after. I have to learn, of course, everything. So we met in Portugal in April 2024 for a couple of days, and I was trained and tried to understand and learn this. So this new diagnostic is you're taking a sample in your arm, and after that you can detect the material what is leaking out in the blood. So when you have dementia, if that is 100%, 62% is Alzheimer. The rest is cardiovascular dementia. That means the vessels is narrow and the blood is not flow through the brain. and one is called front lobe dementia, what is also quite common, like 10% or stuff like that. But the majority is Alzheimer. And if you look on a patient who have died, you can see the brain. It looks like a Swiss cheese. There is holes or cavities in the brain. And that material, what is creating these cavities, is leaking out in the bloodstream. And it's possible to measure the quantity. And the quantity is not milligram, microgram, or a nanogram. It's picogram. It's minus 12 gram per liter. So it's such small quantities what we can measure with 3 decimals precision. So today we could see like 5-10 years before a patient is developing something we call Alzheimer, that we today can see in memory tests, and we can see on the behavior. But and these new 2 pharmaceuticals is developed in the late to use in the late stage of Alzheimer. So that means we have some memory loss already with the patient. But I was traveling around in Middle East a couple of times. I was in Portugal, I was in Switzerland, I was in North America, Chicago, I was in Latin America, Colombia, I was in Georgia, I was Hong Kong, I was in Australia. That was in 1 year on world congresses everywhere, and put up a booth and discussing with the key opinion leader. And everywhere I was so impressed about the work, what we have done to get it through is so diagnostic is even more important than the treatment itself. But today it's 150 compounds in pipeline for Alzheimer's disease. 2 are approved and is on major markets already. But the other ones maybe could be much better in early stage of Alzheimer's. So maybe if you are 50 years old and you can just measure with a blood test, you can see that, okay, you need this treatment to not start the degeneration of the brain. What is?
That's huge.
And because first it was cardiovascular disease we died from. After that, it's cancer disease, what we died from. But I think many of us will die from Alzheimer. So Alzheimer is a disease that you die from. It's not a disease that you die with. But the other dementia, like the cardiovascular one, you can die from something else and have cardiovascular dementia. But this degeneration of the brain, what is going on with Alzheimer, is a terrible disease.
Yeah, correct me if I'm wrong, but I have Alzheimer's. It's more of like a female, old women. It's more common in old women. And is there a difference? Is dementia, is that like early stages of Alzheimer's?
I think it's not if it's a man or a woman, it's just that the case that the women are getting older. Like
they live for longer.
Live for longer.
Yeah.
So they have a higher probability to get something like that in the end.
The man dies of the heart attack.
Yeah.
The woman lives for 5-10 years longer, and the Alzheimer's gets her.
Yeah.
Yeah, that's what it is. Yeah.
Why is that? That's not fair.
I know. I worked in a hospital when I was a kid, and all the old women that were there had, not all of them, but a few of them had Alzheimer's. And the men, the common thing in Ireland years ago.
No, I mean that we die earlier.
Because the women live smarter. We're like battles out of hill.
Yeah. Must be that. Okay.
Yeah.
No,
but what is interesting, I think, is the priority to subsidize or to support this treatment in different countries. Here we have a very restricted approach to this treatment because we think it's too expensive and we don't think it's worth the money to give a patient like 5 years extra. If the memory loss is like that, and if you take treatment, you get 5 years flat, and after that you get a new slope down. But as I worked in Middle East, when the money is not a question, they are very much eager to start with these brain centers to put patient in, or to put people in already when we are 50.
So just say now, for example, so it's detected early, and is it like a type of medicine that you take orally, or is it like a treatment?
It's injectable once per month.
Yeah.
And after that, the degeneration, the creation of his cavities is going down to zero during the period. So if we take our test, we could see zero material of the brain loss during the treatment. So it's really fantastic.
All right. Is there side effects to the medicine?
Not heavy ones. So if the patient is detected from the very beginning with good diagnostic, he or she will benefit from it in the most cases.
Yeah, but there's always going to be side effects, and then the people allergic reactions to medicines and all that kind of stuff. But this is it sounds like it's a cure.
Yeah.
If it's detected early.
Yeah, it's not a cure. It's just stabilizer for a period of time. It's not stabilizing forever.
All right.
But as so much research is going on, I'm sure that this will be, like in all therapeutic area, better and better. We will find better drugs, better diagnostic, and who should have what will be. Yeah.
There seems to be a big breakthrough in medicines now, so in the last few years.
Yeah.
Yeah. Yeah. So in years to come, if you catch it early, you can maintain it for maybe 5 years.
Yeah.
Maybe 10 years. And then after that, then old age will take over anyway and your organs will fail.
Yeah, I think depending what stage the Alzheimer is, probably one drug will be perfect in the beginning, one will be better in the middle, and one will be better in the end.
Okay.
So if we can keep up the quality of life for the patient so they can live instead of going to live in institutions, what is very common today. The couple are separated due to the woman or the man can't take care of the other. I think that's really worth the money to stay together another 5 years.
5 years is a long time when you're old.
Yeah.
Yeah. If you have the quality of life.
Exactly.
I don't want to be an old man and sick as a dog every day.
No.
This doesn't sound good. No. Parkinson's can there be? That's something that's a tough one as well.
Parkinson is handled on the same type of congresses like Alzheimer, so it's a neurological disorder in the brain. But I understand that it's more difficult to treat, and fortunately it's not as many patients it is with Alzheimer. So the number of people who are affected by Parkinson is much less. But I know that a lot of research is going on, but I have no deep insight in that area.
Yeah, I have it down, a little bit down is the boxer's disease. A lot of people that have suffered from head trauma, they seem to develop Parkinson's.
Yeah.
So, yeah.
We can see on boxers, for example.
Muhammad Ali.
Yeah, there's so many of them. Yeah. You're never going to retire, Mr. Widen. What are you doing? You're in London now, and
we are working in another area of people with low HB values to try to solve that area. And I think we have a couple of patents already filed, and One is worldwide approved already. The other one is on its way. We got a positive response from the authorities. So I can't say so much more about that.
Yeah.
But one area I think can be interesting today, the growth of the pharmaceutical business, 70% comes from the weight loss products like Ozempic. So, and I'm amazed, especially in Sweden, how the willingness to pay out of your own pocket is amazing. So even patients or people who can't afford other things, they easily put up 3,000, 4,000 per month on the pharmacy shop.
That's vanity.
Yeah.
How you look.
Interesting.
Yeah.
And
today, 7.5% of all households in Sweden have one or more people who have used this, they call GLP-1 analogs. They are a group of products. Ozempic is the first one. And what is happening is when you take this, you lose your appetite. So if you put your sandwich on the table, half of it is enough. You don't eat the other part, or you don't eat it at all. So it creates you are not hungry. You're not hungry. You're not hungry.
You lose your appetite, yeah.
Yeah, it's and it works perfectly. We can see big weight loss on patient, and from that perspective, it's good. But let's say regular weight loss is that you eat more healthy vegetables instead of pizza and so on, and you go to the gym or you take a walk or you make some exercise, and that keeps your muscles awake, and it's good for your body to get. But when you take this injectable, you normally eat the same junk food as before, but a little bit less of the junk food. Okay. And you don't exercise more because you take this product. So in percentage, you're losing more muscles than fat when you go down. And when you stop after 1 month and have a break with the treatment, and you eat your pizza on regular, what you're gaining is fat. And after that, you take a new treatment, the muscles a little bit more away, and you're recovering way more fat. And I believe when we get older, we need muscles for sit in a chair, walk to the toilet, do your thing. So I think we are facing some issues in the future, and we are considering now to develop something. Maybe it could be that's to save a little bit more about the muscles and not.
Yeah, people are obsessed with looking good.
Yeah.
We all know it. If you stop using your muscles, they disappear.
So a lot of people see that, okay, it's shrink inside the shirt, but with what quality?
You're weak after it.
Yeah.
So let's all keep exercising.
Yeah.
Marathons and
If I do a marathon, kilometers.
If I do a marathon, Mark's agreed during the break that he will do an Ironman.
Okay.
No, but we are living in a society of shortcuts.
Quick fix.
Yeah.
But listen, Mr. Widen, it's been absolute pleasure having you here. It's been an experience, and doing all the research and everything that I had to do. I tell you one thing, it's an eye opener about how much one man can impact. So I thank you for all you've done.
Thank you very much.
Yeah.
It was a pleasure to be here.
No, it's ours.
Yeah. Thank you very much.
Yeah.
Thank you.
I don't know how to say goodbye in Hungarian, but I'd say it in Irish. Slán leth. Agus gur man.
Okay, so I did Dutch. Tot ziens.
Okay.
Okay.
Yeah.
Thanks, boys.
Thank you.
Thank you very much.
Bye bye.